Good evening and welcome to RFL. I'm Richard French. Now, instead of fading away like the president said it would, the coronavirus is continuing to spread at alarming rates, slamming areas that had not originally been hit that hard.
Our big metro areas seem to be rising very quickly, and some of the models are, on the verge of being apocalyptic.
That doctor at Baylor University, he is talking about cities specifically in Texas. In a minute, we're going to be speaking with a leading health official in Houston, and he'll describe conditions on the ground there. Now, that Baylor doctor also said if the current trajectory continues, Houston will become the hardest hit city in the United States and even rival what we're seeing in Brazil. Brazil is in the news a lot these days, and for all the wrong reasons. The pandemic is raging in that country. It is also one of the only major countries besides the United States that's seeing such a rapid rise in cases. And this chart, I think, tells the story very succinctly. The green and the orange lines that are heading up, they represent Brazil and the U.S. And as you can see, they're climbing the fastest. Things so bad that our European allies are lumping us in with countries like Russia and the aforementioned Brazil over Washington's inability and seemingly lack of concern when it comes to controlling the virus. Now, as the European Union starts to reopen, it could actually ban Americans from entering their countries. As they say, stay tuned. Now, if you look at the numbers, it's frankly hard to blame our European friends. More than 122,000 Americans have now died from the virus, and that is the most by far in the world. The numbers, they are trending in the wrong direction, though, even though, like other European countries, they're on the down curve, ours in the wrong direction. The U.S. has reported 38,000 new cases in just the last 24 hours. That, for all the wrong reasons, is a new record. The CDC now saying the total number of cases could actually be 10 times higher than is being reported. As you can see from this map, the South and the West, they have the most red and orange, which means they are spiking. Blue shows places that are trending down, and that includes much of the Northeast, including New York, which, of course, was the epicenter at the beginning of the outbreak. Governor Andrew Cuomo in New York saying that hospitalizations in the state have dipped below 1,000 for the first time since March, and now New York, New Jersey, and Connecticut, they're trying to stop the hardest hit states from spreading COVID into their states.
People coming in from states that have a high infection rate must quarantine for 14 days. You can violate the quarantine until you get caught, and then when you get caught, you're in mandatory quarantine and you're fined thousands of dollars.
Now, Florida, for example, one of the states that Governor Cuomo is specifically talking about. In just the past 24 hours, think about this, Florida has reported more than 5,000 new cases. New York, it is a fraction of that amount, just to show you the different directions the states are going. Some states chose to require masks and social distancing, among other measures, but others, like Florida, not only chose not to, but they bragged about it, and now they're paying the price. In fact, as a reminder, 1 month ago to the day, Governor Ron DeSantis, he talked about all the good fortune in Florida, and he pointed an accusing finger at other states.
How is it fair to them to just be airdropping in people from the hot zones, bringing infections with them and seeding the communities with new infections that they're trying to stamp out? But we also just think it's bad policy to have people dispersing from there and then seeding other parts of the country, including the state of Florida.
In fact, he went on to wag an accusing finger at the media, saying, why don't you guys pay attention and say how great a job Florida is doing? Everything's fine here. Now, however, the numbers in Florida continue to surge. Some people lining up for hours, as you can see here, as early as 2:30 in the morning just to get tested. But instead of providing more support, listen to this. Washington, the administration, is pulling back on help to the states to do more testing. The federal government is ending its support for many drive-through testing sites and telling the states to take over. If you want to, go in your own pockets. Now, those sites span 5 states, including Texas, which is also experiencing that surge in cases. It all fits President Trump's pattern of questioning the need for testing or, frankly, even lying about it. Remember when he said everyone who wanted a test could get one? that wasn't true when he said it months ago, and it's not true now. Plus, he is still spewing nonsense when it comes to testing, including saying that he wasn't joking when he said he wants to slow down testing even with COVID raging in America.
Were you just kidding, or do you have a plan to slow down testing?
I don't kid. Let me just tell you, let me make it clear. We have got the greatest testing program anywhere in the world. We test better than anybody in the world. Our tests are the best in the world, and we have the most of them. Testing is a double-edged sword. In one way, it tells you you have cases. In another way, you find out where the cases are.
Still, I don't know how either of those things are bad, but apparently he thinks hearing about cases is a negative. Now, every top health expert, including members of the president's own task force, say testing, it's not a good thing, it's critical, including in that group Dr. Anthony Fauci, who, by the way, says he hasn't even spoken with the president in 2 weeks. Think about that. In the height of a pandemic, our head of our CDC not even being able to get FaceTime with the president. Well, tonight, we're going to focus on one city, as I said, one of the new epicenters, if not the, Houston, Texas. Texas Governor Greg Abbott, he has just announced that he is halting the state's latest reopening plans as the virus spreads quickly throughout the state. The Lone Star State reporting, more than 5,000 cases in just the past day, which is unfortunately a new record, and no city getting hit harder than Houston. Now, the major hospitals there, they're running out of ICU bed space, and they're making contingency plans for the overflow. And that is putting a strain on the frontline workers like this nurse at Houston Methodist Hospital.
And when they don't survive, you know, knowing that we did everything we possibly could to restore their, okay, you're going to make me cry now. No, I have a hard time talking. Give me a second. This is the hardest part about the whole thing. I'm sorry.
It's okay.
And Houston Mayor Sylvester Turner urging residents to do the right thing to stop spreading.
So this is very real. This is a healthcare crisis, and quite frankly, your failure, for example, to wear masks or to engage in social distancing directly impacts on somebody else.
So for more, let's bring in our guest, Dr. David Persse. He is the health authority for the Houston Health Department. Well, lay out, as you see it, Doctor, the current state of affairs, because we're understanding that you could be at 100% ICU capacity. I know that you have solutions for that in the short term, but we're hearing in a couple weeks that may be unsustainable. But we're getting mixed reports from different hospitals. Overall, what would you say the state of Houston is right now vis-a-vis COVID?
Yeah, you're right. You're getting different reports from hospitals because they don't all fill at the same rate. And so some hospitals are already at capacity, and we have been working to help them spread the load, if you will, across other hospitals. But those other hospitals are now starting to fill up as well. And so for the moment, with great cooperation across hospital systems, which, you know, generally they're in competition with each other, but they're working hand in hand now to help each other out. But if this continues much longer, then, you know, apparently it is apparent that at some point all of the ICUs may be full.
You know, I saw the head of the Texas Medical Center saying if the trends continue, we're going to be completely overwhelmed. I know you saw some of the modeling, including from Baylor, saying if this continues the way it is, his term was apocalyptic. Other hospitals, 4 CEOs say that the level of panic unwarranted. That all said, as you try to get the people of Houston to take this as seriously as possible, where do you put the level of concern where you are today and where you could be in 2 weeks?
Yeah. So I'm never a fan of panic. Panic never solved anything. So I don't think people need to panic. We do, however, need to pay attention to what's going on. The hospitals are doing a good job of trying to work together to be able to manage the load. The public needs to do more of its part. We've got some Houstonians that are doing a great job of wearing face masks and social distancing. We've got another group that seem reluctant. And there's a small group that just seem that they are, you know, they just can't be convinced. Well, it's that middle group that we need to get them to shift over and start wearing the masks and social distancing.
One of the things, and I can speak to what happened in the Northeast at least, take New York. Governor Cuomo rang the alarm bell, and maybe there was some panic in there as well, but it got through. Obviously, it was quarantining, but masks were worn in the main. There was social distancing was practiced. Threats came along with it. Houston doesn't have the same relationship with Austin that, let's say, New York City did with Albany. The Texas governor for a while wasn't on the same page with Houston, and then only later said, well, you guys do it your way, but you're not going to have a mandate coming from the state capitol to put a mask on. And obviously we know what's coming out of the federal government and this administration, this president. How much of that has made a difficult situation that much harder and that much more frustrating? Because if people just had the flipping masks on, it would make a material difference. That part should at least be the easy part that people will get on the same page.
Well, I completely agree that the politicization, if that's a word I can use, the politicization of the wearing of masks has not been the least bit helpful. And I don't think that history will look back and be very forgiving of that. But as we're getting to the point now where people are just recognizing that they really do need to wear the mask, and they make a huge difference. Now, they're not the be-all to end-all. It's the physical distancing is hand in hand, so you can't have one without the other. But certainly we need to, all of our leaders need to be on the same page. And sometimes they are, and sometimes they're not. And that's just, the way life always is. But society, people are smart. They need to pay attention to the facts and respond accordingly.
Doctor, with the new development, at least that we're seeing, that many more younger people are making up the positive COVID population. I know on the one hand it's good that their hospitalizations tend to be shorter in stay and the mortality rates consequently. But conversely, you've got now a bigger population that could be carriers that would put so many more people at risk. Is that one of your biggest challenges, getting through to that younger population that they're not bulletproof?
Yeah, and we were all young. I remember being young, and I remember having that false belief that I could do anything and I would be fine. There's a couple of points that we need to get across to young folks. And one is the fact that, you are going to become infected. You are likely to have minimal symptoms. You're also likely to spread it to somebody who will spread it to somebody else. There's a metric we know that if one infected person infects 2.5 other people within the next 5 days, and that's what we call the R-naught, the replication number, but if it's at 2.5 and they do it in a society of people that are all behaving the same way, within 1 month, one infected person could create 406 other infected people. If you reduce that in half, so that one infected person only infects 1.5 or 1.25 other people, and then everybody else does the same, it drops down to 30. So, little things can have a huge difference. The flip side of that is complete ignorance of what's being asked can have a huge negative impact.
Finally, you're in a city that's got some of the greatest hospitals in the country and some even in the world. How concerned are you, though, that there's not a bubble around Houston or Dallas or some of the other cities? In more of the rural communities, they don't have the capacity whatsoever to handle what might be coming down the pike. How worried are you as a state here that once you get outside some of the bigger cities and this spreads, right, it could be devastating?
So you're right from two directions on that. So when we have a hurricane that comes in here to Houston and it hits the city and our local hospitals get overwhelmed because of either the volume of patients or the fact that the roads are all flooded or there's power outages, but there are things that negatively impact our hospital's ability to care for patients. We have developed ways that we can quickly transfer patients out across the state of Texas, predominantly into less densely populated areas or into some of the other major metropolitan areas. So that's not going to be available to us when those small rural hospitals are already full, taking care of their communities. So there's no way for us to move patients from downtown Houston out to a rural county if that county hospital is full. The flip side is that those rural hospitals are generally not, they don't take care of as critically ill patients. Their routine is that when they get somebody who's beyond their capacity or their capability, they'll send that into Houston. Well, they're not going to be able to do that if Houston is full. So if we're both full, we can't move patients back and forth. And that has been a safety valve for both the urban hospitals when during weather, and it's been a safety valve for the rural hospitals when they get a particularly complicated patient. And if there's no room at the inn, there's no room at the inn.
Dr. Persse, I know you got some challenging days and weeks ahead of you. I wish you the best of luck, and I appreciate the time today.
Thank you. Thank you very much.
All right, everyone, when we come back, as we know, nursing homes, they've been devastated by COVID as the people who live there are the most vulnerable. After the break, we're going to show you the situation in Massachusetts, which is now nothing short of a crisis.